So chronic inflammatory demyelinating polyradiculoneuropathy is an autoimmune disease, which means that body is hitting our own body, and it's targeting the myelin sheath, which is the fatty part and also the insulating part of our nerves. So CIDP has been known for a long time, and subcutaneous IVIG has also been known for a long time, however, as a maintenance therapy. IVIG is the first-line drug as an starter and also a maintenance therapy. At the same time, we do not know the tolerability, safety, efficacy in long term. There are some RCTs, and we wanted to combine those RCTs. So I really want to thank our doctors who combined this meta-analysis, including Dr. Mudassar and Dr. Abdullah and all team from Pakistan and USA for doing this meta-analysis. With subcutaneous IVIG, we have another options of maintenance, which is more plausible because at the same time it's convenient for the patient, and also the dosing can be spread out as well. With this meta-analysis, what we wanted to check is the relapse rate with subcutaneous IVIG, tolerability, safety, and efficacy. And that's what we tried to do from the RCTs taken from 2018 to 2024, 559 participants overall. And what we found was the relapse rate actually decreased with an odds ratio of 0.26. And at the same time, there was tolerability, and there might be an increase in the subcutaneous reaction secondary to infusion site. However, overall, it did very well. And also the scores which we looked at, disability scores, there was an overall improvement, which showed that this really has a promising future and needs more large controlled trials to show the efficacy and tolerability in future as well.